Hi, a very good afternoon to everyone. A warm welcome to Mount Alvernia Hospital's Facebook Live event, Quality Care for Every Child. My name is Melissa and I will be your host and moderator for today's Facebook Live event, answering questions on pediatric care and parent craft. Before we kickstart today's session, I would like to say a big thank you to Mount Alvernia Hospital for organizing this event, together with Kinder Clinic and Parent Craft Department of Mount A. We are also very glad to have Mead Johnson Nutrition as our event sponsor. So first, let me introduce myself and the speakers that we have for this afternoon's event. My name is Melissa, and some of you might know me as Melissa Seco on Instagram. I am a content creator and an entrepreneur. So our first speaker that we have coming on board is Dr. Terence Tan. Dr. Tan is a consultant pediatrician and neonatologist with Kinder Clinic based in Mount A. He has been practicing at Mount A for more than 20 years and has 4 children who are growing up really quickly. In addition to his interest in PD medicine, he is also interested in issues like parenting and bringing up children. So you are definitely speaking to someone who's very passionate about all the issues that we're discussing today. He's very happy to be here and to meet everyone online. Our next speaker for the event will be Rita Francis. She is currently working as a senior parent craft counselor, lactation consultant in Mount A, and she's a state registered nurse and midwife, and she has been there for 22 years since 1999. She's also a certified IAIM infant massage instructor, and her daily work is to conduct childbirth education to parents, to be and to assist new mothers to achieve successful breastfeeding and quality care for babies. So before we jump right into it, I know many parents have a lot of questions for our speakers today. We shall first get to questions regarding the general health care of children, of immunization, and of course, well-being of babies and toddlers. So the first few questions that we have are for Dr. Terence Tan. I think this is a very common question that most people want to know and want to ask. So, babies are supposed to be scheduled for their vaccinations. At what age should they be vaccinated? Is there a schedule for it? Are the vaccinations safe? And the most important, will there be side effects from these vaccinations? And what are these side effects that we should look out for?
Well, the broad principle, thank you for having me, first of all. So the broad principle of vaccines for children is this, because babies and young children are vulnerable to old enemies and some not so old enemies. So the role of the vaccines is to protect our kids from many of these conditions, diphtheria, whooping cough, measles, hepatitis B. So the principle is always to give the vaccines in a timely way, because some of these diseases tend to attack at a certain age. Some tend to attack when they're very young, so these vaccines tend to be important when they're young. Other infections tend to attack when they're older, so the vaccines are given around about the time when they need it. And there are also some considerations. For example, certain vaccines are more effective when they're younger. Certain vaccines are only more effective when they're older, when the immune systems are more mature. So the schedule, as outlined by our National Childhood Immunization Schedule, or NCIS, is prescribed a list of vaccines given to our kids born in Singapore, from birth all the way to about 18 to 24 months. Now, every country has its own kind of list, and many countries there's a great degree of overlap, because many of these conditions are similar between the children between different countries. Nonetheless, there are some peculiarities in certain countries. Whether they're safe or not, it's actually a very important consideration for kids, because we are giving vaccines. Basically, we're giving something for kids who are otherwise well, and certainly we do not want the kids to suffer from major side effects. So by and large, most of these vaccines have been used for decades now. So the routine vaccines are now generally thought to be very safe. And we must remember that although nothing is absolutely 100% safe, we always weigh against the risk of not getting a vaccine and getting the disease instead. So all parents are actually it's good to think through when giving consent to vaccines. But by and large, the medical community feels that it's always safer to vaccinate our kids.
are there any common side effects, that we should look out for? Because I mean, after getting the vaccination, even personally, when Noah goes for a vaccination, I tend to look out for like, I don't know, fever or any other side effects. Would there be any that are like things that parents can take note and kind of preempt?
Yes, certainly. Every vaccine is slightly different. The commonest side effects will be things like fever, some irritability, some soreness in the injection sites, and different vaccines have different severity. Some have more fever, more in terms of fever, and some have less. And some of the vaccines don't hardly ever give any side effects at all, by and large. And they're also grouped into major and minor side effects. Major meaning more serious, but thankfully less common side effects, and minor often are more common, but also less severe side effects. So by and large, before every vaccine is given, the doctor or the nurse giving the vaccine will outline to the parents what particular side effects to watch out for. But by and large, most common, it will be the fever and some soreness at the injection site.
Okay. Another question for you, Dr. Tan. When should parents schedule their first appointment, with their doctor?
Well, that's a great question. Most of the time, whether you're born in a public or private hospital in Singapore, the babies have contact with the doctors and the nurses already at birth. So their first contact already happens when babies are born. Usually, we will want to see the babies in the outpatient clinic at about end of the first week of life. That's when a few things happen, when we have to be sure the jaundice isn't too high, we have to make sure baby is gaining weight, and that's when most parents also run into a bit of trouble managing the babies, various things that happen. So usually by the end of the first week is the first visit.
Okay, thank you. I think a very common concern, especially for parents, would be sudden infant death syndrome or SIDS. At what age is that a really high risk, and what are some things that we can do to prevent it, or to avoid it, of course?
That's a good question too. SIDS is very frightening, especially those of us who have kids. We are worried that something very unfortunate or very unforeseen may happen suddenly. So there are some risk factors, and I think the major risk factor over the years is that SIDS is statistically related to prone sleeping position, which means sleeping on the tummy. So we don't really understand, medical fraternity doesn't really understand why that is, but we know that it's linked. And because of that, for worldwide, all pediatricians, all nurses have been telling the parents to put the babies back on their backs to sleep, or it's probably termed as the back to sleep program. It's been and that back to sleep sort of strategy has brought the incidence of SIDS down to a very much lower rates than previously. There's also somehow the lower incidence of SIDS in the Far East than in the West. We also don't understand why that happens. But nonetheless, the recommendation for sleeping on the back is for everyone. So that's the first thing. The other thing that sometimes we tell parents to reduce the risk of SIDS is to be very careful when baby is co-sleeping with the parents in the same bed, because there is data to show that co-sleeping increases the risk of SIDS. There are the things that make it safer, but by and large, you have to be aware that increases the risk a little bit.
Okay, thank you. I think that is also a very insightful thing to note about co-sleeping, because I think many parents, even myself personally, enjoy the convenience of co-sleeping. I co-sleep with Noah, but definitely in the earlier months when he's like a newborn or a really tiny baby, I have to understand the risks associated with co-sleeping, and I guess co-sleeping and SIDS are definitely correlated in some way. So thank you for sharing that. With regards to babies and toddlers falling sick, most parents get extremely concerned, especially when a baby runs a fever, because there are lots of risks associated with a high fever. At what point should we actually take the infant, the baby, or the toddler to see the doctor? Is there a timeline, or like immediately when there is a fever, or is there a certain like temperature that we need to take note of that is considered really high, and at what point should we just bring him or her in to the hospital or to the PD directly?
Well, I think it varies a lot. I think the biggest thing is how old the child is.
Okay.
And when a child is very young, or sometimes it looks like a mild infection at the outset, may not be very mild and may turn out to be something serious. On the other hand, in older,
Very young. Is there a age? How old would you consider like very
the very, very young is deemed as the newborn. So by
okay?
definition, the newborn is the first 4 to 8 weeks of age of life. So in the very youngest children, even a fever in the first couple of months of life is deemed to be an urgent thing, and you have to come
Okay.
in. So that's one of those things. The youngest children, we tend to respond quicker because, first of all, they are young and their immune systems are not fully mature. They don't mount a good, strong response. Secondly, they don't complain. They're not old enough to complain. It's not easy to see when a very young infant is really sick, just by looking at them. And thirdly, it's because they're very small, and so sometimes they can get dehydrated really quickly, and the problems arise very suddenly. The youngest children in the first couple of months, any infection, we probably recommend seeing the doctor soon or right away. And then after 6 months, we were a little bit more relaxed about it, but still careful. I think we can go by three major parameters. There would be like feeding, how well the child's feeding, whether feeding well versus feeding poorly. When a child who's feeding poorly, we know that that's something that's not good for the kid. If the child is sleeping or not sleeping, because if something disturbs the child's sleep, or child can't sleep, whether he or she is in pain or in discomfort, and whether the child is very cranky or grumpy, the mood of the child. These are the parameters by which we can use roughly to gauge how bad or how urgent the condition is before deciding to see the doctor or not.
Okay.
So, and when the kids are even older, I think you can fall back on how confident the parents are in managing. So some parents are very confident because their fourth child, you can manage the small ailments on your own. On the other hand, if it's their first child and it's a very young baby, sometimes it's safer to bring to the doctor to just make sure things are all right than to guess and to struggle on your own. So it varies a lot, really.
Okay. Thank you so much, Dr. Terence. Your sharing is definitely very informative and very insightful. We also have some questions for Rita right now with regards to childbirth preparation, infant care, and breastfeeding. So, a very common question that moms, especially first-time moms, need to know and want to know is when can you tell you're in labor? Are there signs that people can watch out for, and what are some of these signs?
Okay, labor and delivery itself are stages of pregnancy many women are anxious about. Now, if you're well informed about the stages and the signs of labor, physically and emotionally, you're prepared and you are confident to go through this childbirth in a fulfilling and a joyful experience. So if you're asking me about signs of labor, there are 3 signs of labor. First is show and regular contractions followed by rupture of water bag. Now these 3 signs doesn't come in a sequence. There's no 1, 2, 3 to it. Yeah, so if you have show, it isn't an urgency to come down to hospital for other signs to happen. So what is show is actually a mucousy plug, which actually is at the neck of the uterus. During pregnancy, the neck of the uterus is being sealed with this mucus plug. So when you go into labor, the neck of the uterus loosens up and this mucus plug gets dislodged, and the discharge that you see is either blackish, pinkish, mucousy discharge, showing you that you're going into labor. Now, if it's contractions, time your contractions, what are regular contractions? Now, basically, contraction starts from the back most of the time. It comes down to the tummy. Some ladies are sensitive. They even feel at the thigh level as well. Squeeze kind of feel at the tummy. So if they have regular contractions, normally the intensity of the pain gets more and more, and the frequency of one contraction to another contraction get closer. So ladies, if you have a regular contraction, please do come down to the hospital because most of the time, the regular contraction synchronized together with the opening of the cervix. It means the door starts opening at the bottom. Now, rupture of water bag, it is a protective environment. So if the water bag broke, it's either a gush or trickling. So if you see a water bag being broken, do you need to come down to the hospital? I would say yes. Yes. So take note of two things when the water bag breaks. One is the color, one is the time. What time did the water bag break? Now, what colors are not good colors? If you see a green color with the water bag running out, it probably is not a good color because the baby is distressed inside. Baby might have passed motion inside. Now, why green if you ask me? When the babies are born, newborn motion is greenish and blackish in color, which is called meconium. So therefore, when the baby is inside the tummy and baby is not doing so well, they might pass motion and this gives off a greenish color. So if you see a greenish color, it's not a good sign. You have to come down to hospital. Even normally for amniotic fluid color is clearless. So if the water bag breaks, come down to the hospital immediately and take note of the time because the nurses and the doctors will ask you what time did the water bag break because within certain frame of time, it's good that they deliver the baby to prevent any infection setting in for the mother and the baby. Some doctors even give a dose of antibiotics as well. These are the signs of labor. So everyone is different. Don't compare between your friends, and it doesn't come in sequence. And make sure baby is moving and kicking you well and all that. Yeah.
Thank you. That's a lot of information, and I think it's a little more daunting for first-time parents, that have never experienced this before. Will there be any, antenatal classes as a first-time mom, especially to attend, so that we can actually prep better for the arrival of the baby?
There is definitely antenatal classes. If you see, basically most of the antenatal classes are going online. In fact, Mount Alvernia is going to have one launch soon. So please join us in our antenatal classes because you can learn a fair bit of things to prepare yourself for your childbirth, for your newborn, and even breastfeeding. So, we have a panel of experts teaching in most of the classes. Physiotherapists teach on your positions in labor, breathing techniques. Your dietitian will teach about nutrition during pregnancy. And over here, parent health specialist and lactation consultant, we talk about labor, what are the signs to look out for labor, how do you manage yourself in labor, especially the spouse. Spouse is really, really an important factor because research has shown a supportive spouse has positive outcome to the labor process. Yeah. So it is really important to take note of that. And care of newborn, how do you take care of your newborn? How do you burp the baby? How do you swaddle them? How do you bathe the baby? And for breastfeeding, how to get off with a good start. Now, early initiation is important. Skin, so many factors is involved. So I'm sure it is a good thing if you can actually engage in these prenatal classes. You will definitely benefit from it. Trust me.
Definitely. I actually have been through the class myself together with my husband James, and we have been really great beneficiaries of it, especially in the aspect of breastfeeding, because as a first-time mom and having absolutely no clue about breastfeeding, having somebody to physically guide you and show you what to do, how to do it, really makes a world of difference. And it's not just learning like everything from the book, but actually having a little bit of hands-on experience. I remember during one of the classes we actually carried a fake baby, and at that time it was Sister Kang that was going through the class with me, and she actually taught me the different positions to hold the baby when breastfeeding. And even for my husband James to learn them so that he could assist.
Yes. So the husband is a very important factor.
I recommend that. Okay. With regards to breastfeeding, I've got more questions for you. Is breastfeeding painful generally? I know it's different for everybody, but most moms say that breastfeeding is could possibly be even more painful than childbirth itself because you don't have epidural anymore and stuff. What is your take on breastfeeding?
Okay, breastfeeding shouldn't be painful. If it's painful, please come and see us. We will guide you through. Okay, so the latch is so important. If the baby is latched well, it shouldn't be a painful latching. You see, when you're breastfeeding the baby, it's a very beautiful moment. You and the baby and the entire family has to enjoy the whole process. So you need to establish a good latch, make sure the suck is strong sucks and not weak sucks. And there are different positions in breastfeeding. First of all, attain the good position. And mummies, they need to relax themselves first, probably drink a cup of beverage, warm beverage or warm soap first, to warm up the system first. Massaging of the breast is important, and get a good posture to latch the baby. Deep latch is so important. Now, what are signs of deep latch? Most of the time, the chin should be touching the breast, cheeks are ballooned up, no dimpling, no clicking noise, no the sounds, because breast latch should be a vacuum seal. You shouldn't have an air entry down there. And most of the time, if you see the lower lips are flanked out, it shouldn't be flanked in, no dimpling. So these are the signs you can look out for. Now, if the baby is latched well, now let's look at sucking. Now, sucking, if the baby is sucking rapidly throughout the feed, it shows that the baby is not sucking well. Baby should suck rapidly in the first moments, then you should have a suck, swallow, and pause. So these are the signs you need to look out for. And once you unlatch the baby, your nipple should look round and nice. It shouldn't look like an old lipstick up and down, or it shouldn't look flattened, and it should look round and nice. There shouldn't be a soreness down there. So, anatomical of the baby's mouth and the breast and the areola nipple is made such. So that's the reason it's called breastfeeding and it's not nipple feeding. So I encourage all the mothers to breastfeed, and please come down for prenatal classes to check on your breasts and your nipples and everything. We can teach you, and we always encourage you to have early initiation of breastfeeding. Skin to skin is so important because it makes the baby calmer and warmer. And the baby actually crawls up to the mother's chest and they find the right position to latch. Why the areola nipple and nowhere else? How come they're so smart, if you ask me? The key thing is the areola emits amniotic fluid smell. So you see, when it emits the amniotic fluid smell, they are familiar because they are there for 9 to 10 months inside the tummy. And they go there and they latch and suck. They have 9 stages of crawling. It's such a beautiful moment because that leads to a initial good startup for breastfeeding. And rooming your baby, I would strongly encourage you to room in the baby, recognize early cues, and latch them, get the nurses to help out. So these are the key things to take in to start early initiation of breastfeeding, and have a good, successful breastfeeding.
Okay, I think with regards to a good latch, I understand the importance of that. And would that actually have a bearing on milk supply? Because many moms stress out about, not being able to provide for their baby, about having low milk supply. So how can you ensure that you have enough milk, and will it be safe to say that every mom would have enough milk for her baby, or is it different for everybody?
Okay, storage capacity of the breast is different from every mother. So the babies are smart. If the storage capacity is less, they try to feed more frequently to adjust to the nutrients needs and to their and fulfillment of their appetite as well. So if you ask me, a deep latch is important, and make sure you empty one side of the breast before offering the other side of the breast. Because if your breast is full, perhaps about 3/4 full, and it's not well emptied, then it signals to the brain not to produce enough for the mother. So really, you have to empty one side first before offering the other side. And most of the time, the fore and the hind milk has to come out first before offering to the other side. So emptying of the breast is important, and mothers shouldn't stress themselves. Let nature takes its course. I'm sure all mothers can produce enough. And if they want to boost up the supply, after latching on both sides, they can rest for an hour. They can also do pumping as well. But nothing beats the baby. Latch the baby more, demand, supply.
Okay, and with regards to breastfeeding, there are so many questions with regards to breastfeeding. Do you actually wake your infant up for feeding, or do you just do it on demand? When the baby cries, then you feed?
Okay,
to wake
newborns,
according to a schedule.
Okay, newborns especially, we would always say breastfeeding is unrestricted demand feeding. When we look at newborns, it'd be good if you can feed at least about 8 to 10 times, or even 12 feeds in a day, because newborns are rather sleepy. So sometimes you have to get them up to feed them. And then no restriction of timing on the breast. Make sure you empty one side before offering to the other side. And whatever goes in has to come out. Watch out for signs of baby having enough. Number of urine is important. Number of motion is important. The color of the urine is important. The color of motions are important as well. So if the urine is indicating a dark urine, pinkish, bloodish urine, these are signs of dehydration. And the motion from greenish, blackish, it has to turn to yellowish mustard color, perhaps from day 4 to day 5. Now make sure the baby looks satisfied to you, and they should be putting on weight. They shouldn't lose more than 10% of the birth weight for the first 1 week. They're allowed to lose 7% for the first week, but a gradual 7% and not a drastic 7%. Now by day 8 to day 10, they should go back to the birth weight, and subsequently a weekly of 200 grams increment each week. And when they ask me when to follow up with the weight, by 4 to 6 months, they should double the birth weight, and 1 year so they should triple the birth weight. These are signs to show that baby is thriving from your breastfeeding.
Got it. Okay, that's we've got a lot of questions coming in on Facebook Live, and we have some more questions for Dr. Tan now. So I'm going to be rotating between Rita and Dr. Tan, and we'll see how many questions you can answer during this very short session. So back to you, Dr. Tan. Some toddlers tend to catch a cold very frequently. Sometimes even every other week. A mom asked this question about improving the immunity of her child. And for me personally as well, I find that Noah has fallen sick a lot more since starting school because he's being exposed to maybe other kids falling sick and I don't know, just being out more. So is there something that we can do to improve the immunity of the child? And is that a normal thing, or is that something that we should be concerned of?
Yeah, well, thanks for the question. It's a problem that we struggle with as parents, and it's something that, especially nowadays with the current COVID situation, it becomes doubly stressful. Babies, when they come into this world, they are fairly well protected, not only because they don't go out very much, but because moms also, through the pregnancy, have conferred quite a lot of antibodies through the placenta into the baby. So when they're born, they have quite a lot of antibodies from the moms. And those antibodies stay in the baby's circulation for several months. And those antibodies, though they're not produced by the child themselves, the children themselves, so they slowly go away. So by and large, by about 9 to 10 months, the babies lose all that sort of maternally acquired antibodies. So for about late infancy, you'll find that the babies tend to fall sick a bit more frequently. At that time, the kids also start going to infant care or later childcare or in schools or in play school. And you find that for the ages from 2 years all the way to 5, the kids can fall sick very frequently. Now, the immune system's function is to protect and defend the baby. So whenever exposed, the baby's job, the job of the baby's immune system is to fight and to win. So what we want to see is that despite falling sick, we want to see the kids recover. And that's what we want to know. Now, as for the frequency, some studies report that it's common for kids to fall sick every 2 to 4 weekly. So the question from the mom, he's sick every other week, is unfortunately a typical experience for most toddlers, especially if you're going to childcare or playgroup. The good thing is that most kids with competent immune systems will be able to fend off, fight, and recover from the infection. And in doing so, they build up their immune system. So falling sick is not, in a sense, not always a bad thing. Of course, no one likes our kids to fall sick. But in falling sick, they get stronger. So it's also a flip side to getting the infections, in that they attain immunologic maturity. They get stronger every time they fall sick. So most parents don't have to worry about the fact that they fall sick frequently, as long as they recover. I know, they recover well and recover nicely without, and they're well in between the infections. Let's put this way.
Okay, and I think also
boost is, I forgot to answer the question directly. What to boost? Okay, the falling sick itself does boost the immunity already. So the act of falling sick makes them stronger. Just like the feeling tired after exercise makes you more able to deal with stress later. Falling sick makes it stronger. Now, as for supplements, nobody really knows. There are some data to show that the vitamin C and some other supplements do help certain kids, but I think there's no panacea, there's no magic bullet for supplements to say that if you take this supplement, you're not going to fall sick, because falling sick is the means by which the kids become stronger and develop their immune system. I think a good nutrition, a well-balanced diet, lots of exercise, fresh air, I think that's the most important.
So on the topic of falling sick, like sometimes you know it's an illness, but on other occasions it might be an allergy. how can we tell, whether it's an allergy or an illness? And if it is an allergy, will the children actually outgrow it, or is it like a lifelong kind of thing?
Good question. Okay, it can be confusing, especially if the symptom is a cough and runny nose, because cough and runny nose is a common set of symptoms for both infections, like cough and cold, as well as allergy. So allergic airways, they tend to have cough and runny nose. Of course, and it's even more confusing because an infection will trigger your allergic conditions. So if you catch a virus, not only does the virus have symptoms, the virus itself triggers your allergic nose and sometimes even asthma and all those things. So it can be confusing. And sometimes when things aren't clear, we actually treat for both conditions. When it's really an infection, usually there's fever, the kids are cranky, they're unwell, the nose is dripping like a tap. The older kids can complain of a sore throat. The feeding is down, you can see that they're grumpy. On the other hand, most kids with kind of regular severity allergy, they can have a runny nose, they can have a little bit of cough, but there's no fever. And the symptoms of the allergy varies within the day. For example, you can have a runny nose, drippy nose in the morning, and then as the day goes on, the drippy nose goes away and there's no more cough, and they are well for the rest of the day to the next morning. So there are some clues that give us some clues that give us an indication whether that cough and runny nose is an allergy or is an infection. I think fever, the presence of a sore throat, the severity, the very severe ones tend to be cough and cold. Allergies, of course, can be severe, but they tend to come and go in the course of the day sometimes. When in doubt, of course, bring the child to see the doctor if it doesn't settle down with routine regular treatment. As to whether allergies improve over or disappear as the kids grow older, the proper term is probably not so much disappear. The proper term when it comes to allergy is whether they evolve. So some kids, when they're born, they have very sensitive skin and they tend to have childhood eczema. But that tendency evolves as they grow older. The eczema may get better, but they can have sensitive sort of airways and they can be wheezy babies, toddlers. And as they grow older, the wheezing goes away and it evolves into a sensitive nose kind of thing. So although they tend to kind of change, some kids who are very allergic, the allergies tend to evolve rather than disappear.
Okay. Is there actually any correlation between some people when they have newborns, then they're very particular about like friends and family kissing the baby? Is there a myth or is there like some truth to it? Like, should we avoid kissing babies and toddlers too much?
There's no such thing as kissing a baby too much. So whether you're a parent or a politician, you shouldn't. Yeah, there's no such thing as kissing too much. So on the other hand, the kiss is it's very close contact. So if you are as an adult is sick, and you will pass the infection to your baby. Okay. So I suppose that's one issue. Yeah. I mean, a very young newborn, the first month or two of life, you also transfer skin bacteria. So it's sometimes the kissing causes the kids' acne to kind of be a little bit worse than it could be. I think my take, and most doctors would say that no child grows up in a bubble, and I think the displays of affection to a baby, I think, can only be good for the baby. Yeah. So I think unless the adult is very sick, or the child is in a special situation where it's a very premature baby, or you want to restrict contact for a while until they grow a bit older. But otherwise, I think as long as the adult is well, don't stop kissing a baby.
Speaking from a parent himself.
Yeah, definitely. One of the joys of parenting.
Yes, definitely. Okay, we've got another question from someone watching on Facebook. I mean, given that the announcement yesterday has kind of put us in a mini circuit breaker now, do you recommend for us to keep our children at home instead of going to the childcare, or should life, should we just proceed with childcare until, restrictions for like childcare and stuff start closing?
Okay. I know every parent is responsible for our own kids, and I can't say, but my advice will hold true for every parent listening in, because in the end it boils down to how we want to look after our own kids. I personally feel that Singapore generally tends to respond quite quickly to our community outbreaks already. And we trust that health authorities will take action and will stop the schools or will close the schools temporarily should outbreaks start occurring significantly in schools. So now going to childcare, going to school does confer some advantage for the kids, especially developmentally and learning. And COVID is not going to go away anytime soon. So if out of fear we don't send the kids, where do you draw the line? And where do you foresee this outbreak ending? On the other hand, um, no parent, not even me sitting here today, has the broad view of what the outbreak is like. So I think we have to trust that policymakers, that Ministry of Health is aware of the situation on the ground, and will advise parents not to send when should really come about that it's not safe to send the kids to school. I validate parents' autonomy on this, in the sense that if you feel that you want to keep your kids out for a particular period out of uncertainty, fair enough. But then again, how long do you want to keep your child out? For 2 weeks or 2 months? In the end, I think we still have to trust that the Ministry of Health is aware and will keep us informed of the situation.
Definitely, yeah. Okay, thank you, Dr. Tan. Now we have some questions for Rita. Okay, for Rita, we've asked you questions about breastfeeding and about labor. Someone also asked, what do moms need to take note of after giving birth? So are there any like postnatal care tips that you have to share with moms?
Okay. Once delivery is done, you'll be going to the ward called postnatal ward, and there, after the marathon of labor down there, you'll be rewarded with your buffet confinement food and all that. So much of proteins down there. So ladies, please eat a well-balanced diet to build up your proteins and all that. And as much as you can, there are pain occurring from after pain from the uterus, which was so big during pregnancy, which is to adapt to the baby size. Once you have delivered, ladies, your uterus has to shrink into a tennis ball size. So this shrinking can cause you this pain called after pain. Now, there are painkillers available for you in the ward to take as well. And please have good sleep. And even with mothers with a C-section down there, the wound pain is there, the epi wound pain is also there, but there are painkillers also there to help you to cope with the pain. And some gynaes will even give you a wash at the perineum at the bottom, or even a wash at the bottom, or to take care of your perineum wound. And not to worry, the stitches will dissolve by itself, so you don't have to remove the stitches. And ultimately, you need to rest well, eat a well-balanced diet, and while you're in the hospital, learn as much from the nurses how to take care of your baby. And I again strongly encourage you to room in the baby, as it does, builds up your confidence to look after your baby as well. So these are the things you need to look out for once you've delivered.
Okay, so with regards to breastfeeding, also while the mom is taking care of herself, are there things that moms should be mindful of when consuming things? Because they say that like what you consume actually goes into your breast milk. So are there like things that you must definitely avoid? I know people like try to avoid alcohol, or they pump or they dump. So
sometimes, Melissa, in confinement food, they have the wine, I would say rice wine, if I'm not wrong.
Yes.
So if you have some wine in the confinement food, you can cook and vaporize it, and you can still latch on the baby. You can still breastfeed, no harm in that. Now, what if you're taking like Dome and like a small little pack? Perhaps you can wait for 2 hours after you're drinking the pack of Dome, and then you can latch the baby as well. Yeah. So, and for medications, not all medications are compatible to breastfeeding. So do not self-medicate yourself. If you're not well, please go and see the doctor and get medication that is compatible to breastfeeding. Right? Drinking alcohol and all that is more of the safety of the baby, because we don't want to be so, not in a very alert state and then you're latching the baby. So it's more of the concerns of the safety of the baby, I would say. Okay. Even for coffee, when you're drinking coffee and everything, sometimes one coffee should be fine. And some babies are a bit more sensitive. The moment you take 2 cups or 3 cups, they can show signs of, irritation, a bit of fussiness and all that. Then, yeah, there's a caffeine that's setting in. Yes. So you can look out for all this.
Mm. I got a very interesting question as well that's very relevant to a time like now.
Okay.
What if I am like COVID positive? Can I still breastfeed? I heard somewhere that there are antibodies that you can pass on from mom to baby. If I don't know if your body is like fighting some infection or something, then like all the more if you're sick with a certain virus or a flu, then you should still continue breastfeeding your baby. Is that true? And how about if it's COVID?
Okay. COVID and breastfeeding. Now, a lot of research are still done with the COVID and breastfeeding thing. And I would say that you can, mothers who wants to go for vaccinations and everything for COVID, yes, they can still breastfeed their babies. But if they want, they can actually stop for, probably they can actually pump up about 5 to 7 days of stash. And then once they're vaccinated, they can actually give the express milk to the baby, then continue again. But I would say that you can still breastfeed your baby because there's antibodies in it. But the type of most of the time when the baby is sick or even when the mom is sick, it builds up the correct amount of antibodies and everything to fight with the infection. That's the beauty of the breast milk, you see. But more research has to be done, I guess, to validate whether you can really breastfeed when you have a COVID infection.
Okay. Thank you for that. And now on questions about sleeping. For Rita first, someone said like they actually swaddle their baby, but he suddenly wakes up due to shock. So how do we prevent that? Because I mean, people say that if you swaddle your baby well and tight, it helps to calm them and help them feel secure. How do you prevent a baby from waking up in shock?
Okay. Babies would have the suckling reflexes. So sometimes when you remove the swaddle, their hands start shaking and all that. So these are startling reflexes, which is really, really common. So the moment they startle, hold their hands, touch their chest and say, "It's fine, baby, mommy and daddy is here." Calm them down. Now, touch is such a powerful sense. In fact, touch is the first sense that develop in a baby. And a nurturing touch from the loved ones is so powerful that you can calm the baby down. Use your voice to reassure the baby and carry your baby. Never a time you're spoiling the baby when you're caring, when you're nurturing them. That's why infant massage is so beautiful. And the touch itself will kindle a lot of things. Mom feel relaxed, the oxytocin gets released, she feels more relaxed, and in fact her breastfeeding, prolactin hormones gets more, and she can produce a little bit more, and baby gets calmer, and a whole lot of physiological changes in the baby. So I would strongly encourage parents to learn infant massage, to have a beautiful nurturing touch for their new. It's a lifelong kind of thing. I have girls, my girls are big, they're 15, 12, and 10, and I still massage them. Really, really a beautiful experience. So come on and learn your infant massage, because it is how important is breastfeeding is. Infant massage is also very important for touch. Yeah, I strongly encourage.
Yeah, I fully agree with you. I actually also massage Noah, and I actually do that to kind of calm him down and put him to sleep, especially on nights where he's a lot more active and playful. I find that really helps, and I actually learned that during my session at Parents Craft.
Yeah, especially for the colic and the constipation and all that. I have gotten massages as well. Yeah.
So I guess we can debunk the myth that like people always say, you shouldn't be holding your infant too much because you're spoiling him or spoiling her. I personally don't agree with that, but I guess you've just confirmed that there's no such thing as too much, right?
Never.
More the merrier.
Yeah, yes, the more the merrier. Give them a positive assurance that you are there for them. Crying is the only way they communicate with you. So recognize this crying and attend to them immediately.
Okay, so more questions on the topic of sleeping, because I think that's something that a lot of parents struggle with. Especially like people say that there are different leaps and stuff. So when the baby is a newborn, and then as he or she grows older, you face different obstacles along the way, and sleep is usually a very, very, I guess, big obstacle, because sleep is firstly so important for the child, but yet a big challenge for the parents. How do you actually get your baby to sleep? I guess this question can be open to both Rita and Dr. Tan. Are there tips that you like to share, especially as parents yourself, on how to get the baby to sleep? And if the baby is just going through sleep, or is there something that's wrong that we're doing and causing the baby not to sleep regularly at proper hours or throughout the entire night?
Don't overstimulate the child, especially when it's sleeping time. Their brains will be so active that they want to do some things.
Okay.
Make sure the environment is cozy and create a routine time for sleeping. They will soon adapt to you. Trust me, newborns and babies are clueless what's day and night. Yeah, but they will adapt, in a while. Make sure you feed them well. Temperature of the room shouldn't be too hot, shouldn't be too cold. No direct fan, and feed them well. And reassurance, make sure they are there. Your touch and everything is also important to let them be relaxed, and you can calm them down, and they can fall asleep. Anything from you, Dr. Terrence?
So yeah, I find that I get a lot of questions about sleep at various age groups. So it hits you in the face the moment the baby is born, because you realize that babies, when they're born, they don't respect night or day, and they usually sleep in the day, and they're usually fully awake at night and fully demanding at night. So we really expect that, because in the womb there's no night or day, and so in the end, we as parents have to kind of follow the baby's sort of clock, rather than expecting the baby to follow our clock. And I think that's the first thing, There are some things that interfere with baby's sleep, things like acid reflux or gastroesophageal reflux, heartburn, or infantile colic. So those things we may have to deal with along the way. But by and large, we expect upside down sort of sleep pattern in the first couple of months of life. Okay, so what influences the baby's brain to switch into the proper day-night cycle is actually the influence of light and dark on the baby's brain. So in the day, try to keep the baby in the brighter sort of environment, because it is daytime. And the night, try not to keep all the lights on, despite the fact that baby may be crying or needy at the night. So when the baby's brain experiences light and dark, hopefully over the next first couple of months of life, they settle into a proper day-night cycle. And like Rita says, a routine, a comfortable sort of environment. I think babies are creatures of habit, so they fall into a routine. So the routine, the winding down and so that, it helps with sleep. And baby massage definitely helps sleep. Well fed. One of the things that sometimes gets past attention is if you're breastfeeding, especially, is stimulant food. So if the mom drinks tea or coffee or stimulant or takes stimulant foods, and you're breastfeeding, it goes into the baby in the breast milk, and the babies sometimes get kind of a bit more awake in the night when they're not ready. And then, of course, our part as doctors, there are certain things that interfere with sleep. If they're sick, with their allergies, with acid reflux, there's asthma, you need to watch out for those symptoms.
Okay, thank you, Dr. Tan. Now a question for Rita. When is it a good time to start baby on semi-solids? What is the transition like? So
6 months, I would say.
Okay, so what's the most ideal in terms of breastfeeding for as long as possible, or is there?
Now, WHO and HPB has recommended 6 months, and then you start semi-solid food when you're six months and above, while you still continue to breastfeed 2 years of age or beyond, because the composition of breast milk changes according to the child's age. So no matter how big the child age, the nutrients is always good for the child. Okay. Protective factor for the child as well.
And in terms of like fussy eaters, do you have tips for babies that for parents that are finding it difficult to properly transition breastfeeding to solids?
Most of the breastfeeding babies, their taste buds are very sensitive. Most of the breastfeeding babies. So most of the time they're not too fussy, but if you want to know more about weaning and everything to semi-solid foods, our dietitians are available over here. You can actually call to Mount Alvinia, give them a call, and they can guide you throughout how to start with a good starter for weaning of foods. Probably create a creative way of putting up the pellet, the plate down there so they can actually explore and start eating and all that. Yeah. So dietitian will be a better person to talk to. I'm sure they'll be able to help you out.
Thank you. And with regards to taking the COVID vaccine after giving birth, I'm personally interested also to know this because I'm gonna be due soon. Should we take the vaccine right after giving birth while still breastfeeding? Is it safe?
Okay. Vaccinations, is it for Dr. Terence or is for me?
Uh,
I can take that. I can take
Yeah.
that because I
Okay,
get that.
yeah.
So the current guideline from the MOH and Ministry is that the COVID vaccine, the current vaccines at this point, are safe, are compatible with breastfeeding, but there's a recommendation, and this is just a cautionary recommendation, that moms should express and discard for 5 to 7 days following the vaccine while they're breastfeeding. Although it is not an absolute necessity to do so. So there are many moms who get the vaccine and continue breastfeeding without stopping. And so far, the experience has been quite okay. And I think the worldwide experience with breastfeeding and the COVID vaccine so far has been reasonable.
Okay.
Yeah.
Okay. So back to you, Dr. Tan, about probiotics for kids. Do you recommend them? Should I be giving my kids probiotics, and at what age should I start?
So probiotics is a whole world of probiotics there, because probiotics vary so widely in the type, in the range, and in their function. So every different bacteria has a slightly different effect, and even as we speak, it is the hot topic in nutrition circles right now. The role of probiotics and how they affect the growing child. So, well, a baby from birth already receives probiotics in a sense, because bacteria comes into their gut from the point of delivery. They swallow the amniotic fluid, and bacteria starts colonizing the bowels. So these are good bacteria. They are our friends. So they're what we call commensal bacteria. So commensal bacteria help the immune system, help prevent allergies, help produce vitamin K, help cause so many things, so many metabolic functions in our body. So when we give a child probiotic, basically what we're trying to do is we're trying to dictate what sort of bacteria colonize our children's bowel. There's still ongoing research, but the data shows that it does seem to help in reducing the allergies somewhat. It seems to reduce infantile colic somewhat. It helps the immune system mature also. So I think on the whole, it's a good thing. You need to weigh that with the additional cost of buying a particular probiotic. You also need to weigh that against the inconvenience of remembering and putting a probiotic. So there are a few considerations there. But on the whole, it's not a bad thing to give a probiotic. We don't make it mandatory, but if you are able to kind of find the cost acceptable, I think it's a good thing.
Okay, thanks for the tip. One last question for you. What about introducing plain water to babies? Because some people say, okay, first 6 months, 100% breast milk. What's your take on introducing plain water?
Okay, so water is necessary for life, but the recommendation is to give water in the form of milk for the first 4 to 6 months. Yeah, and the reason for that is twofold. Number one, when the babies are very young, their kidneys aren't fully mature yet, and so they can't handle too much water, because we can take a liter or two of water and our kidneys can kind of flush it out. But babies, when their kidneys are very immature, they can't. So what they do is that they can accept the kidneys can end up flushing away their salt, and it can be dangerous. It's called water intoxication. The other thing is that if you give a lot of water, then they can't take the milk, because the babies have that amount of capacity. You see? So what we want to do is not to take up the room and give the water in the form of milk until about 4 to 6 months. Then it should be quite safe.
Understand. Thank you, Dr. Tan. I have one last question for Rita as well. This is for moms that are currently pregnant like myself. Is it okay or safe to continue breastfeeding your first child or second child, or is it just basically okay to be breastfeeding while you're pregnant?
It is definitely okay to breastfeed while you're pregnant, because that's what I did for my kids as well. It's called tandem nursing. So it is okay, the bond can be enhanced with your older child and your younger baby once the baby is born as well. The only thing is with tender nursing when you're doing during pregnancy is sometimes your nipples might feel a bit tender, a bit sensitive. The older child when it starts drinking and everything, these are the times they actually wean off themselves. But if the older child is actually latching and you're enjoying the whole process, then it shouldn't be an issue to continue with latching while you're pregnant. Even after you have delivered, your baby and the older child can breastfeed together because the breast milk turns into cholesterol, which is high in antibodies and proteins and all that. So it's good for both of your babies. I would say priority is the newborn once the baby is born for the feeding. Then comes the older child, but you can breastfeed both at the same time as well. It enhances the bonding between both them and yourself, and especially with an active toddler and everything. You are actually you look at them at the same time, and the older one can touch the baby and hold their hands. Such a beautiful bond is there, you see, and the older child can actually help you to release your blockages, your engorgement, and everything. So it is really really good if you can do tandem nursing. It's a very good experience.
Thank you. I think just one last question. Do moms need to take any supplements when breastfeeding? Would you recommend supplements for moms breastfeeding?
I'm sure when you're pregnant and everything, your gynae gives you your supplements and everything. That should be good enough. So eat a well balanced diet and drink enough water to quench your thirst, even after you have delivered and all that. And balance enough, yeah. So some others would take a pregnancy milk and all that to build up the nutrition level. You can do that as well, but never in excess of anything. First, very important not to stress yourself. One day at a time, eat a well balanced diet, rest enough, and enjoy the whole 9 to 10 months of pregnancy. Yes.
Nice, thank you. I guess we will now wrap up the session. We've had like really good takeaways from this session. Thank you to the both of you for sharing all your experience with us. I guess maybe we can just end off with Dr. Tan. If you have any other tips and advice for all our viewers today on like just general healthcare and well-being of babies and toddlers.
Oh wow. Okay, so this is if Melissa's always heard me say that you only go down this road once with each child. So
Yeah.
enjoy the time with the kids. The time slips through your fingers too quickly. Second tip, I suppose, is don't struggle with anything if you're uncertain. Always seek help. There's always a lot of help available.
Yeah, I think that's like definitely 100% true. Thank you so much, Dr. Tan, for all your insights and your valuable time today. Rita, do you have any last words to say before we wrap up?
It's a bliss to be parents. So enjoy the whole process, the milestones and everything. And we're always there for any queries, any help. And we work as a team, physiotherapists, our dietitians, our doctors, our pediatricians, and us. So we are there for you. So
Thank you. Okay, thanks, Rita. Thanks for your time and for sharing this afternoon as well. So we are wrapping up now. We have actually come to the end of our Facebook Live event. And we thank you so much for tuning in to the live session today. We hope that some of your questions got answered and that you've also gained valuable knowledge in today's session. Of course, if you would like to rewatch the session today, you can just head over to Mount Alvernia Hospital's Facebook page and you will be able to find this video in their live tab over there. Don't forget to like the event and share this video with your friends and for anybody that you think might really benefit from this session as well. We're also happy to announce and to share that Mount A will be launching its first online childbirth education course very soon. Very appropriate, especially for a time like now. So you're not going to miss out. Even if you can't attend a physical class, do look out for their online childbirth education course that will be coming live very soon. So just stay tuned by following Mount Alvernia Hospital for updates and events on various topics from maternity and medical services. Follow them on their Facebook so that you don't miss any information that might be valuable to you. So thank you so much for joining us again today, and we hope that you guys have had a good time and gained something from today's session. So have a good week ahead and a good time. I mean, especially for moms, enjoy your journey with your little ones, and all the best to you. Thank you. Bye.
Bye. Stay safe.